Welcome to VTV, a medical program which is known as We Care. We bring to you to make sure that there is awareness of the health issues, and if you have any question, you can always ask this question to us. My name is Muhammad Iqbal. I'm a consultant at Salford Royal Foundation Trust. With me, we have an honorable guest, Amy Lennox. Amy is a specialist audiologist who particularly specializes in vestibular medicine or the balance medicine. She has got a special clinic in Liverpool called Hypatia. Is that right?
That's right, yes.
Welcome to VTV.
Thank you for having me.
It's a pleasure. It's a pleasure. So today we are going to talk about some ear, nose and throat issues, and you are most welcome to ring us if you want to ask any question about your personal problem or about a family member. Then we will try our best to answer you. Let's talk about the hearing aspect first of all. And Amy, the ear consists of three parts: the outer ear, middle ear and the inner ear. Now outer ear is like what we see outside pinna and the canal.
That's right, yes.
And then the middle ear is the eardrum and three small bones.
That's right.
And then this structure leads to the inner ear. So what is the function of the outer ear, middle ear and the inner ear?
So the outer ear is where we have the sound that funnels through down the outer ear. We have the canal, and the canal acts as a way to amplify the sounds that go in, and also protection. So that's where we get a very common issue is earwax.
Yes.
Yeah.
So what you mean to say is this, that the nature has created the outer ear so that the eardrum is not just sitting outside.
That's
it is
correct.
very well protected,
That's
quite
right.
deep inside.
Yeah.
Otherwise all the insects and the injuries could easily damage
That's
the
right, yes.
eardrum.
Yes.
Right, and that's outer ear. So what about middle ear?
Okay, so the middle ear, if you start with the tympan or the eardrum, and you look at the bones, that amplifies the sound, and it turns the sound from an air energy into a mechanical energy, so then it can be transmitted into the inner ear.
So when the vibration comes to the eardrum will vibrate, and this vibration will be transmitted to the small bones. As you mentioned, the small bones are called ossicles, I understand.
That's correct, yeah.
Now these vibrations through the eardrum and through the small bones will be conveyed to the inner ear.
That's correct.
Now is it right that the middle ear will contribute to 19 times more sound, which is equal to 40 decibel more?
That's right, yes.
So if somebody didn't have middle ear, they will lose 40 decibels.
That's correct, yes.
Right. So that's an amazing structure to give us 19 times amplification.
Yep, yep.
Right. Then we come to inner ear. So what is the structure and function of the inner ear?
So we have the hearing portion, which is the cochlea, and it's like a snail's shell, and if you roll that out like a piano, it's responsible for picking up a range of sounds from low frequency to high frequency. Now humans can hear between about 250 hertz all the way up to about 20 kilohertz, which is quite a big range. Inside the snail-like shell, you've got the fluid, and what happens is the bones are like a piston, and they move that fluid, and that's how we hear the sound.
Right. So you said that it's a shell-like structure, which is 2.5 times shell-like structure, and inside there is fluid. So the vibrations of the small bones is conveyed to the inner ear.
That's correct.
And this inner ear is going to convert this vibration into electrical energy, which is going to convey to the brain through the nerve of the hearing.
That's correct, yes.
And this amazing structure, as we know, consists of small hair cells, which are very, very tiny hair cells, and these hair cells will act as like a hydropower, which
right.
converts the mechanical energy into electrical energy.
That's correct, yes.
And this amazing structure then converts the vibration into electrical energy, and then it gives this to the brain, which perceives this as sound.
That's correct.
Right. So, and you said that the human ear can hear from 20 hertz to 20,000 hertz. but most of our speech is between 250 to 8000
That's
hertz.
correct,
So we
yes.
don't need that much frequencies to hear, because 250 to 8000 hertz is the speech frequency.
That's the speech frequency, is correct.
But beyond 8000 hertz frequency must be some animals like bat,
Correct,
rat,
yes.
and
Yeah,
other
yeah.
all
And environmental sounds as well, so
Environmental
warning
sounds.
sounds.
yes.
It all stems back to when we were hunter-gatherers. So those outside frequencies were more kind of the warning frequencies,
Yes.
whereas our speech was brought into our own kind of frequency that we use, not dogs or other animals. We use 250 to 8.
Yes.
Yes.
You said something very interesting. In the holy books, it's written that when the earthquake was coming, the rats were running faster than before the man could understand that earthquake is on its way. And that is only because the rats can hear the low vibrations much earlier than the humans.
That's correct, yeah.
Yes, it's
Yes.
amazing that once you study the science, you understand that those messages in the holy books were not wrong. So what we understand is that one of the function of the human ear is to conduct the sound from outside to the brain. But what is the other function of the ear?
So the second function is we have our balance organ. So our balance organ, which is next to the snail-like shell, you've got 3 separate, they're like loops, and what they are responsible for is how you are moving your head. So if I'm doing this, I'm activating one here and one on this side, and if I'm doing this, I'm activating one on this side and one on this side. Along with that, we also have 2 other organs in there which are responsible for when we move forward and when we move up and down as well. So it's quite a complicated system.
Right. So in the balance system, there are 2 organs, as you said, semicircular canals, which are 3 loops, which are known as semicircular canals.
That's right.
And then the other structure, which doesn't have any loops, which
That's
is like
right.
a little bag.
Yes,
Bag.
correct.
And one is related to the angular movement, and the other is related to going up and down, like in the lift,
Yes.
or going forward, backward,
Yeah.
but not angle. Once it comes to the angle, the loops or the semicircular canals becomes important.
That's right, yes. Yeah.
So this is how they can control all movements
Yeah.
of our body and make sure that these movements are conveyed to the brain.
That's correct, yes.
Now, people suffer with a condition known as dizziness or balance problem. Now, I understand the dizziness is a sensation of being imbalanced. So there are different definitions of dizziness. So some people will say dizziness is like feeling lightheaded. Others will say feeling like boat in a sea or a storm.
That's right.
And third will say that room is going round and round, or I am going round and round. So the person is going round and round. So there are different definitions of dizziness, or there are different descriptions of dizziness.
That's
So
right.
when the people come to you, how do they describe their dizziness?
They talk about everything that you have mentioned, and often when people come to see me, they've had it for quite a while. So what that means is they may say that originally it was a spinning sensation, but now it's more like I'm walking on the moon or marshmallows. So it can change over a period of time depending on what has happened to that person.
Right. So we are going to look into the medical conditions which can cause the hearing and the dizziness. So let's start from the outer ear. Now, the hearing issues in the outer ear can be caused by, for example, wax, you said?
Wax, yes.
Right. So people do come to you with wax problem?
Yes, so next door to me there is a very excellent wax removal service. They're at the Liverpool Hearing Centre, and they use microsuction methods. So they have scopes and loops, so they can, when they look through those loops, they can see your ear canals a lot bigger than what it would be, and they just use a gentle suction to kind of bring it out.
Bring it out. So if you have got blocked ears and if you think that your problem is due to wax, it may be a good idea, provided there is no history of hole in the eardrum, it might be a good idea to use olive oil, and if this doesn't work, then visit your GP or practice nurse who is going to look into the ear and advise this same, and may refer you either to a hospital practitioner, which are usually the district nurses, but you can also go to the private centers, as Amy has mentioned. And the wax is something really which makes your world upside down, isn't it? People who come to us, they say that, oh, I can't hear anything, I've lost my communication with the world.
I mean, a lot of my patients say to me how interesting it is that something as simple as earwax causes so much problems. And it really does. It can really impact on people's lives.
Yes, and it's a temporary problem. Once it is cleared, then hearing will come back to normal.
Right. Yeah.
But sometimes it does so happen that people may have some hearing issues. They may not be aware of those hearing issues, but once they get the wax, there is a sudden blockage, so they immediately become aware of the hearing issues, and once the wax is out, their awareness remains, and I think those are the cases where people should have a hearing test.
Of course, yes. Yeah.
Yes.
Yeah.
So hearing problem can also be due to middle ear problem.
That's right.
Right. And also, sorry, before we go to the middle ear, the hearing issues in the outer ear can be due to wax, can be due to infection.
That's right, or a foreign body.
Foreign body, especially children.
That's right.
I have removed amazing things from the children's ear. Just recently, I saw a child with a earpiece plastic in the ear, and I have removed insects as well from the ear. So amazing things are removed from the ear, especially children.
Yes.
Yes, but the elderly people, the people who are 60 plus, they are more prone to wax problem.
They are, yes.
Yes.
And just jumping back to foreign bodies with people who are possibly older and wearing hearing aids, it is amazing actually how if they're at home changing the little parts that they put on the end of their hearing aids, if they've not put them on properly, they can drop into the ear, and that's something that I have previously had to pull a lot of those out.
That's right.
Yeah.
And the hearing aid mold itself can push the wax outside and doesn't allow to come out, isn't it? So these patients who wear the hearing aids, they are more prone to develop wax problems.
Yeah.
So, but the other issues like tumor or any other problem apart from infections are very uncommon in the outer ear. So we go to the middle ear now.
That's right, yeah.
Right. So first of all is the eardrum. Have you noticed people putting cotton buds in the ear and causing rupture of the eardrum?
Yes, I've got a few not very nice stories about that, yeah.
Yes, you do hear from time to time people have done this, isn't it? So it's not a good idea to use the cotton buds in your ear, because what you are doing is you are not removing the wax, you are actually pushing the wax, but some of the wax which is in contact with the cotton wool will come out, and you will think that you are removing the wax. But this can be a very dangerous way of removing the wax, especially if you are going quite deep in and you are very close to the eardrum. Now, eardrum can also be affected by infections.
That's right, yep.
And the middle ear, the two most common causes which can occur in the middle ear, one is infection, right? And especially those who tend to have lot of cold and cough or asthma.
Yes.
Asthma. They are more prone to develop ear infections.
That's right.
Or especially allergic nose and things like that. And those children who are prone to develop the fluid in the middle ear. Now, let me tell you, ladies and gentlemen, that the fluid in the middle ear is formed because the child develops the adenoid enlargement. This adenoid sits at the back of the nose, so it closes the tube which runs from the ear to the nose. Now, the back of the ear, which is behind the middle ear, behind the eardrum, is the space, and this space also gets the air from the nose through this tube. Once this tube is blocked, then the air cannot travel from the nose to the middle ear. and if the air doesn't travel from the nose to the middle ear, then it leaves a vacuum, and vacuum is a negative pressure. Just like if you switch your vacuum cleaner, you will create negative pressure, and this will suck the dust. Similarly, when the vacuum is created behind the eardrum, this will suck the water, and this will also change the lining of the cells in the middle ear to the lining of the nose. And as you know, the lining of the nose will secrete mucus. So therefore, the lining which has been changed in the middle ear in children will also secrete mucus. This is why these children suffer with glue ear, and this is a very common condition, isn't it?
Yeah, it's very common.
Very common condition. So much so that we don't treat the children unless there is an issue of significant hearing problem, speech problem, understanding problem, learning problem, behavioral issues and balance issues. And these are the reason we will either we will give the child some antibiotics as a first treatment, and if this doesn't help, and if the child also needs tonsil removed or adenoids removed, then we will also put the grommet, and in very rare cases we will just put the grommet on its own as an operation, but we try to avoid this if possible. And those who tend to get this fluid problem more often, for example Down syndrome children or children with cleft palate, we prefer hearing aid rather than operating on those children. So do you see children as well?
Not at the moment, but I have, yes, I have done in the past.
Yes.
Yeah.
Have you seen glue ear quite
a lot?
Quite a lot,
Yeah,
yes.
yeah.
It's a very common condition, especially in winter, when it is said that up to 70% of the nursery children can be suffering with glue ear.
Yes.
And the parents are not aware of this because
right.
They are aware that child had a cold or a cough and thereafter some hearing issues, but because it's temporary, it disappears and the child is fine.
That's right, yeah.
But in some cases it persists.
It can persist for quite a while.
Quite a while.
Yeah.
Yes. Now then we come to the some bony problem. There are three small bones in the middle ear. So it is quite possible that either infection or the skin growing from the drum into the middle
That's
ear,
right, yes.
called cholesteatoma, which can disrupt these small bones.
True.
Right. But there is a condition which occurs characteristically in females, otosclerosis.
Yes, that's
Could you
right.
tell us about this condition, please?
So otosclerosis, what that is it's a fusing of the bones. So normally these bones move with the sound energy to get the energy through into the cochlea. But what happens is they fuse and they can't move, so they're rigid, so they can't get the sound through. And that can cause quite a severe, well, a moderate hearing loss, we would call it. Yeah. When we do testing, we usually do a hearing test with some headphones on, and so we test how you hear sound through the outer and the middle ear. And then what we'll do is we'll put a band and we will put a headphone that goes straight on the back behind, and we'll test to see what you can hear just from the cochlea. And if we can see a difference between the two, then that's often an indication of a problem in the middle ear.
Right. So when you give the sound through the bone, it goes directly into the inner ear. So that is a reflection of inner ear hearing. Now, if you give a sound from through the outer ear,
That's right.
and if this sound is not as good as the inner ear sound through the bone, then there is some problem either in the outer ear or middle ear. And in a person who is showing normal ear canal and the eardrum looks okay,
Yeah.
the suspicion is that the
Something's
problem
up
is
in
in
the
the
middle
small
ear.
bones.
Yeah.
And especially when you see a lady who is complaining of increasing hearing loss, particularly with every pregnancy, then you can easily think of otosclerosis.
Yes.
But it can happen in male as well. Yes. Now, one of the caller has requested to explain tinnitus,
Okay.
right? So, tinnitus is a sound which a person can hear without an external source of sound.
Correct.
Which means that there is no source of sound, but the person can hear like whooshing sound, buzzing sound, ringing sound, hissing sound, humming sound. Sometimes people can hear their own heartbeat as well,
That's
which is
right.
little different because there is a source in our body. But we are talking about tinnitus where there is no source. Do you see patients with tinnitus?
Yes, I have, yes.
And is it something which is very common?
It is very common, and everyone experiences it differently. It is a slightly tricky one for us clinicians because it can come from a variety of sources, and often it's associated with hearing loss, or if there's a history of noise. So if you've been in the forces, had a noisy job. I think some of our youngsters now that wear all the headphones, I think a few of them will have it when they're older. Often that's kind of the simplest form of tinnitus, in the fact that you can reintroduce those sounds either through a hearing aid, and normally that's enough to kind of help with any of the
Yes.
effects of it.
Sure.
Yeah.
I'll come back to this topic, but let me explain you. The tinnitus is a sound which you can hear in your ear or in your head without any external source of sound. So this sound can be of different variety. The description vary from buzzing, hissing, shushing, whooshing, ringing, but people can describe this in a different way. For example, they can say it's like a waterfall,
Yeah.
or it's like a kettle hissing sounds, or radio in between two stations. Now usually, as Amy said, 88% of the people who suffer with tinnitus have some degree of hearing loss, whether it is age associated hearing loss or there is an additional cause of the hearing loss, but 88% of the people do suffer with hearing loss. There are about 10 to 12 people who have got normal hearing. For example, you see patients who get whiplash injuries and they can get tinnitus. People who suffer with head injury, who have suffered with head injury, and they may not have suffered hearing loss, but they may suffer tinnitus. And there are some patients who will not have any causation or any problem in the normal hearing group, but they will complain of tinnitus.
That's right.
Whereas in the 88% who complain of tinnitus, there is a underlying hearing loss,
That's correct.
which could be temporary. For example, wax,
That's right. Yes.
which could be temporary in the middle ear, for example, fluid in the middle ear or ear infection.
That's right.
But which could be permanent when the hearing loss is sensory neural or it has affected the inner ear. Now the inner ear hearing loss can be due to either age associated hearing loss, or it can be by working through the in the factories where you have been exposed to the excessive noise, known as noise induced hearing loss, or as Amy said, nowadays children are using their mobile phone, hearing loud music for quite a long.
Yeah, long periods of time is where it's a problem. It becomes problematic.
Yes. So, right now, well, I've been told that a break is due now. So please tune in to VTV. Stay in tune. We will be back very soon. Amy, it will take us a minute or so. We'll come back. Thank you.